we had, just to say, we're recording the session, so that we're going to be putting this onto the council's website for anyone to access after the session. So my name is Barbara Nichols. I'm the Director of Adult Social Care in Havering and Chair of this evening's session. It's good to have you all join our call. So we're keen to have that conversation about what might be worrying you as individuals about getting vaccinated. Could be issues around fertility, pregnancy, what happens once baby's born with things like breastfeeding, and any other issues that you may have. So I'm really pleased to be working with our panel members again, and I'm grateful to them for giving up their time this evening, alongside grateful to all of you for giving your time up for such an important topic. So I would like to introduce Viv in the first instance. You just want to say who you are, Viv?
Yeah, hi everyone. I recognise a few people. Hello, nice to see you all. I'm Viv Cleary. I'm a consultant in public health and I lecture in infectious diseases as well.
Yeah, and Aruna.
Hi everyone. My name is Aruna Ramineni. I'm a consultant obstetrician and gynecologist and lead the fertility unit in BHRUT. And I'm here to answer all your questions about vaccine and having a baby and breastfeeding.
Brilliant, thank you. So our session this evening will consist of both Viv and Aruna doing a presentation, and then we'll follow that with a question and answer session. As questions come up for you through those presentations, please do put them in the chat, and we'll make sure through that Q&A session that we get through those. It's going to be my job to make sure we get through them all, so I'll do my best on that front. We're running for 90 minutes, so I think we'll have plenty of time for questions, and if we run out of time, we'll try and get a Q&A response arranged, so that will be available on the council's website as well. Please do keep your mute button on. You're very welcome to turn your cameras on. It's always nice to see people, but keep that mute button on. We're asking for those questions to go in the chat rather than being asked verbally. However, as we're a small group, there may be that opportunity to ask the question by coming on or turning your mute off. Finally, I must ask that questions are respectful and on topic. If we see any sort of abusive or trolling comments, the individuals will be muted and asked to stop. If it persists, then we may remove an individual from the meeting. So I hope that's okay by way of introduction, and I shall hand over to Viv. Thank you.
Thank you very much, Barbara, and good evening, everyone. I'm just going to share my screen. I think hopefully you can all see that. Yes.
Yep, brilliant. Thank you.
Great. I think really I'm going to just give the background, and I suspect all the questions are going to be more for Aruna, but I just wanted to talk about general vaccines, the kind of vaccines we're using at the moment, and some sort of general public health about vaccines as well. So I'm just going to work out how, it's down there. So I'm going to start by saying that the aim of any vaccine, an ideal vaccine, is you're trying to produce the same immune response that you would if you actually got the infection. So a vaccine will mimic the virus. It doesn't overtake our own immune response. It actually just, and I'll explain what I mean by that in a moment, but it just actually helps us, helps our immune response without actually giving us the disease and making us unwell. And we're also trying to generate longer lasting immunity and trying to interrupt the spread of infection is what we're doing at the moment. And I think these are the challenges for any program, not just COVID, but any program that we come across. How many doses do we need? How effective it is? The strain coverage is going to be really important because you've seen in the news about Omicron. So, you know, how effective is it against one strain like Delta compared with, say, Omicron? Will it give you cross protection? Generally, vaccines do. They'll protect you from severity of disease and death. And then there's all the logistics, which you're seeing in the news at the moment about delivery and workforce capacity and training of staff and getting people on board to roll out the vaccine program. We also need to know the disease factors, like who does it affect, what sort of long-term conditions you might get, and how severe the disease is. And then in this middle bit, I think really is the population factors. So it's about how acceptable are the vaccines, and this thing called herd protection, which we'll talk about in a moment. Now, we are used to vaccines. So these are a few vaccines that we've grown up with, I guess. Seasonal flu, been around since the 1960s, BCG for tuberculosis, smallpox, the one disease that we managed to eradicate through vaccinations. And when I talk about that vaccine acceptance, this is kind of quite normal for, and rightly so, to be asking questions about new vaccines. And I put this picture here because this was when Edward Jenner discovered that milkmaids got a thing called cowpox. They didn't go on to get smallpox. So this was his sort of idea behind immunization and vaccinations. And if you see this picture, you can see when they first introduced smallpox vaccination, people actually were worried that cows were going to grow out of their arms. So you can see these cows in this picture. And eventually this, it took a long time, but eventually the vaccines were accepted and we eradicated smallpox in the sort of late 70s. And I think younger people, I'm old enough to remember this, but you know, in polio was a huge problem. And you can see a real real disabilities, people paralysis, and they had these things called iron lungs where they were stuck in these, we call them ventilators now, but you know, you can see these iron lungs in there. People were really ill with polio. And you can see on the maps on the right hand side how polio was in lots of different countries, and through vaccinations we've managed to stop this dreadful disease. So how do they work? So first of all, what happens is if you're infected by any, and I'm sure we all know this, but it's just a sort of an overview, if you're infected by a virus or any kind of pathogen, you make this immune response. It takes about 3 weeks. Your body naturally builds up antibodies for that infection. You can see my red line there, it kind of peaks and then it starts to go back down. And then what happens the second time you get somebody coming towards you with that infection, you catch that infection, you see this much quicker response. Your antibodies kick in, your memory cells kick in, and it lasts much longer. And that's the idea of the vaccine. So vaccines trying to mimic your antibody response. So the first dose of the vaccine will give your body, it doesn't replace those your body's immune response, it actually helps your body to say, okay, when I see this pathogen, I'm going to make antibodies. And then that second dose will obviously make those much more memory cells and antibodies that will last much longer and go on for a longer time. Some of the worries, I think, originally with these vaccines was the approval process. They felt was quite quick, and we've had these vaccines now for a year. So we are seeing more and more evidence now. And we will say that, you know, it was really unprecedented resources and funding that were able to produce these vaccines. We didn't skip any of the trials. We did all the trials. But normally you have to go through, ask for funding, wait a bit, ask for some more funding. But we had, you know, huge amounts of resources that we were able to run these in parallel. And they've all gone through clinical trials and they've been out in real life now. And so far we've given 8 billion doses worldwide. So that's a lot. That's a lot of vaccines out there. The main ones we have are the mRNA vaccines and the vector vaccines. So the mRNA vaccines are Pfizer and Moderna. That's the ones we're using at the moment for boosters. And what happens is you can see with COVID-19, it's got a spike protein on its outside of the virus. And that spike protein is the thing that it uses to latch onto our cells. Once it's latched onto our cells, respiratory cells, it will then say make copies. So it makes loads of copies. And that's when your immune system has to sort of try and fight back. And what the vaccine does is mRNA vaccines is they basically, they put this spike protein in a bit of lipid and you get injected with that. So your body straight away recognizes this is an intruder. I'm going to start making antibodies to it. So it's not replacing your immune system, it's actually helping your immune system by producing these antibodies. So that when you come across the infection, your antibodies can quickly react rather than having to sort of overwhelm your immune response. Some of the other questions I get really is about the mRNA, and they're really worried. Someone's let off fireworks in the background here, but they're very worried about, what does mRNA and DNA mean? It's two different things. So we know DNA is part of all our human cells, but it's not. We're not using DNA. We're using messenger RNA, and the messenger RNA basically is something that what gives the body instructions to produce these antibodies against a spike protein. The mRNA and vaccines have been around for decades. So although it's a new COVID vaccine, the technology was around for quite a few decades. They've been working on it for other things like Zika virus, rabies, etc. The other one, the Astrozeneca, we've all heard of, and some of us will have had as well. Same principles, but instead of using a lipid, they put the spike protein into this a type of virus, an endovirus, which is modified, that gets injected and the body recognizes it as an intruder and again makes antibodies. So you're still making your own antibodies to this particular infection. So what are the side effects? I would say any medicine causes side effects. So this isn't to say vaccines are perfect. Every medicine, paracetamol gives us side effects. Unlike the disease itself, which we don't actually know if we got the disease, how our body's going to react, most of these are short-term and mild. And these are the common things we've been finding: painful arms, tired headache, flu-like symptoms, etc. Now, I'm sure a lot of you would have read about some of the blood clots, so I thought I would cover that as well. So yes, we found, particularly more so with AstraZeneca, that there are some blood clots, really quite a rare reaction to this vaccine, around 14 people in a million. But because of this, they felt it was only wise to make sure we offer younger people the alternative. So instead of offering Oxford, the AstraZeneca, they've been now offering the Pfizer to 18 to 39-year-olds, mainly as a precaution to this. Now, I've just put some of the figures there. The reason is the risk of clots is 1 in 100,000 for people in their 40s, and rises to 1 in 50,000 for people in their 30s. And again, just to put that into context, that when you think about 14 people in a million, from air travel, you can get a blood clot from 1,000 people in a million. So it is a really rare effect, but I'm not going to say it doesn't happen, but it's happened very rarely. Some people are worried about the contents. So they don't have any animal products in them. They don't contain beef, pork. They're not grown in hen's eggs. And so most of the things found in the vaccines are the things we find in food and other medicines. And the very last bit I want to talk about is the population. I talked about population and public health, and that right at the beginning, you can see here, all these little red people are not immunized, sick and contagious. The orange people are immunized and healthy, and the blue people not immunized but still healthy. And right at the beginning, you can see, there was a lot of us getting this infection. And all we had really was hands, face, space, and lockdowns. And we don't really want to be doing lockdowns all the time. So obviously where we want to get is that more people come forward, more people are immunized, and you can straight away see that if you've got slightly more people immunized, you'll get less infections. But this idea of herd immunity, the more people you can get vaccinated, the less infection will spread. And this is really where we want to be. As you can see here, there might be a few people here not immunized, but generally those who are immunized, you'll start seeing less and less infection. So that's why we want so many people to be immunized. And I'd like to thank Vicky for this slide, because this is, I think, really clever in numbers. So at the top, you can see we've put the year the January on the left-hand side and November. So we tried to compare sort of similar figures. Now you can see this was when less than 1% were vaccinated on the left-hand side, and this was in the UK. We had 31,000 cases, 3,000 odd hospital admissions, and unfortunately over 1,200 deaths. And then when we've got the more proportion of the population vaccinated, 80% here, although we've got 54,000 cases, it really reduces those hospital admissions, 810, and yet, you know, many more cases, and it reduces the deaths to 92 deaths. And just at the bottom is a snapshot really for BHRUT. So these are patients at the same period of time that would be in hospital from Barking, Havering or Redbridge. And again, you can see those, you know, at the beginning, less vaccinations, and then here when we've got more people vaccinated. Now, although I've talked about vaccination, my last slide, I will always use this slide, is that no one thing will protect us. And you can see that things are changing about mask wearing indoors, always hand hygiene, obviously, respiratory etiquette and contact tracing. But to keep ourselves safe, it's not just about vaccine, it's about, we've got all these holes in our cheese, and the more layers of these of infection prevention we can put together, the less likely we are to catch COVID. So I'm going to stop there and pass you back to Barbara.
Thanks very much, Viv. As ever, I find your presentation really good at kind of trying to work through some of the myths, and there in particular that the mRNA vaccine's actually been around for a long time. It was just fortunate that there was a decision taken to kind of focus it's on COVID-19 to produce the vaccination that we've had. Okay, so shall I hand over to Aruna? I think we are going to share her presentation on her behalf. Yeah, that's brilliant. Okay.
Okay. Right. Hello, everyone. We'll move on to the second slide then, as I've already introduced myself. So I'm going to talk about COVID and pregnancy today. So just to say, majority of pregnant women who are infected with COVID will be asymptomatic. So the studies are saying that almost 3/4 or even more than 3/4, 70 to 85% are going to be asymptomatic. But if you're pregnant and you get infected with COVID, you have higher rates of ICU admissions, and overall there are worse maternal outcomes, including an increased risk of death. Though again, the risk remains very low, which is 2.2 per 100,000 maternities. The overall maternal mortality rate in UK is 9.7. So it's not a huge increase, but if you're pregnant and you have COVID, your risks are worse. So what are the risk factors for infection and hospitalization? These are the risk factors we've been we've been hearing about them, we know about them. If you are of a BAME background, that is Black, Asian, and minority ethnic, if your BMI is more than 25, if you have pre-existing diseases such as diabetes and chronic hypertension, if you're pregnant and over the age of 35, or if you're living in areas of households with increased deprivation. Then how does COVID affect the baby? We haven't really found any adverse effects on the fetus or on the outcomes, but what we have noticed is that there is, because the mom has COVID and we want to help the mom, we have an increased risk of preterm birth because we might deliver the pregnant woman earlier or preterm to focus on her. But the overall rates of stillbirth and neonatal death is very low in women with COVID. And breastfeeding, now the recommendation is that you can have the vaccines while you're breastfeeding, it is safe to do so. About planning your pregnancy. If you're planning to have a baby, should you have the vaccine or not? Yes, yes, yes. Please have the vaccine. It doesn't stop you from fertility treatments. It doesn't stop you. If you have the vaccine, and if you become pregnant, it's not a contraindication. If you're planning a pregnancy, it's all the more an incentive to get your vaccine at the same time. So the Joint Committee on Vaccination, the JCVI, has advised that pregnant women should be offered the COVID-19 vaccine at the same time as the rest of the population. They've also advised that it's preferable for pregnant women in the UK to be offered the Pfizer or the Moderna vaccine. The RCOG has come up with a new guidance in October 21st, where they are advising vaccination for pregnant women. So if you're pregnant and you've been offered vaccination, what are your options? So pregnant women are being offered at the same time as non-pregnant women, and we haven't done any trials. So it is still your choice, but the advice now is to have the vaccine, because other than from studies, me as an obstetrician working in the labor wards, I can see how vaccine is protecting people from severe disease. And in the recent wave, we saw more pregnant women severely affected, needing quite a lot of intensive care, and some of them needing ECMO as well. And they were all unvaccinated. So it's very clear when you're working with pregnant women and in the delivery suite that not having the vaccine really puts you at risk. Most women are worried about their babies and they want the best for the baby, and they put themselves second. They say, it doesn't matter what happens to me, but the baby's got to be safe. And the answer to that is to have a healthy baby. It's really important to have a healthy mother, because you nourish the baby. So you have to take care of yourself, and vaccine is a way of taking care of yourself. So your options when you have this choice: should you get the COVID-19 vaccine, or do you want to wait for more information? Like I've said, in October, the RCOG has come up with the advice that we should be vaccinating in pregnancy as well. We were offering vaccine to health or social care workers and women who are at high risk of COVID-19 due to health and personal factors, and women who've had gestational diabetes in pregnancy, or women with a BMI of more than 40. But like I said, now everybody is advised to have the vaccine. What are the benefits of getting the vaccine? So hospital admission and severe illness, which may be more common in pregnant women in third trimester of pregnancy and preterm birth, is more likely if you get the COVID infection. And if you have the vaccine, you would avoid all that. And you have to remember that as from the previous presentation, they do not contain live coronavirus vaccines. They do not have any additional ingredients that are harmful to pregnant women. And we've got experience with other non-live vaccines, such as whooping cough and influenza, which we are routinely giving it for pregnant women for the safety of them and their unborn babies. And yes, you cannot get COVID-19 from vaccination. So what are the risks? There's been extensive information where we've monitored women, more than 100,000 pregnant women, and it has not raised any safety concerns. And as we've discussed before, there's extremely rare but serious side effect of having blood clots with Astrozenica. The Pfizer or Moderna vaccine should be offered to pregnant women, and I think that's what we are offering now. Side effects, as we've discussed, is having a sore arm, fatigue, headache, muscle pains, fever, chills, joint pains, and anecdotally, I'm hearing about menstrual disturbances as well. So again, when should you take it? It should work whatever the stage of pregnancy you're in, and you do not need to check for a pregnancy test before vaccinating, and you do not need to delay pregnancy when you have had the vaccine. And as COVID-19 has serious complications in later pregnancy, some may choose to delay the vaccine until after the first 12 weeks. So as all of us are worried about having congenital abnormalities for the baby, it's the first 12 weeks when the baby is being formed. You can avoid the first 12 weeks and then can have the vaccine. But again, there is no evidence that it affects the development of the baby in any shape or form. Again, as I've said before, these are the risk factors. If you're overweight, if you're over the age of 35, if you're in the 3rd trimester of pregnancy, if you have medical conditions, you're at a higher risk of becoming unwell with COVID-19. If you are at high risk of getting COVID-19, you should consider getting the vaccine. But I think everybody should get the vaccine, really, unless there is a specific contraindication. And how does it affect your fertility? It really does not affect your fertility. You can have your vaccine if you're going for IVF, frozen embryo transfer, egg freezing, ovulation induction, IUI, any of the IVF treatments, you can have the vaccine. So that's me. And usually I end with saying, because as a fertility consultant, I know that many women have questions about, what do we do? The best thing that you can do is to take care of yourself. And by that, I mean having a healthy lifestyle, eating nutritious food. And I think maybe I've said this before, having sex 2 to 3 times a week. As a lot of women want to know when they're ovulating and they try to time it at that time. It doesn't really work like that. Have the vaccine and just try for the baby and have good food. Thank you.
Thank you very much for that, Aruna. Insightful as ever. And I guess just thinking about breastfeeding and vaccination, what's your sort of thoughts around that?
Please have it. It won't affect your breastfeeding. It doesn't affect your baby. You can have it.
Mm-hmm.
Yeah.
Okay. All right. Thank you. So we've cantered through our presentations, and had previously invited people to kind of put something in the chat if they have a comment or a question. Hazel, if you get in touch with my PA, I'll endeavour to kind of get that resolved for you. Beyond that, as we're a small group, does anyone have a comment or a question they want to kind of start us off with? Seemingly not. This could be a very short session for us this evening. Okay. Sorry, go ahead, Becky.
I'll ask a question just to Aruna, if that's okay, around fertility. If you've said anecdotally you've heard of people reporting having menstrual changes after the vaccine, has that been looked into, and is that only a short-term effect? And do we know that that definitely doesn't affect fertility?
It doesn't really affect fertility because, again, we're going through women. I'm advising vaccination. There are a lot of things that affect your menstrual cycle, and like I said, your weight and your hormones and stress levels are all connected to that. So I think it's the same advice I would say, and that is eat healthy, maintain your BMI, and just have sex. No, it really doesn't affect fertility.
Yeah.
Thank you.
And sometimes that can that happening directly after being vaccinated can be associated with the actual vaccine, which is in many cases, as I understand it, coincidental rather than being the cause, the vaccine having caused it. Is that fair,
Yeah.
Aruna?
Yes, it is. I mean, I've got a lot of my colleagues in other specialities, and they're all like, yeah, this is happening. But some of them are perimenopausal, and menstrual irregularities are very, very common in a woman's life. So I think we're just correlating stuff. So.
Yeah.
Thank you.
Thanks for that. And a question has come in our chat around female teenagers in terms of any vaccine risk for them in the future. Oh, sorry, any risk from vaccination in the future?
Well, there isn't any evidence of any risk in the future. No.
Okay.
And what does Viv think?
What's that? Sorry, Aruna?
Yeah, I was going to say the same. I think some of the health there was a lot of discussion around the health benefits of teenagers because they get less infection and they don't become as unwell as older people. And I think a lot of the advice was around education and the trouble of missing loads of education through being off school, etc. But all the evidence so far, and a lot of it's coming again from America, is that the most risk is sort of people fainting and but no risk with fertility or any other health risks. It's more the kind of normal side effects we're seeing with everybody else.
Yeah, okay. Thank you. We've had another question. In terms of blood clots, if you're at risk of blood clots, is the vaccine safe? Can I pass that one to perhaps Aruna?
Yeah, it is still safe.
Yeah. I guess that's worthy of conversation with, say, a GP ahead of any vaccination, who understands your individual or an individual's particular health conditions and risks in terms of getting the vaccine if there are risks of blood clots. Is that fair?
Yeah. The risks of blood clots, if you look at, again, related to BMI and other comorbidities. And if you have that, you're again at higher risk of having a symptomatic COVID infection. So I think you should seriously look at the vaccine and go for the one with less risk of blood clots. So definitely vaccination would be advised.
Yeah. Is there anything you want to add there, Viv?
I was going to say, and I think the other problem is the risk of blood clots if you get COVID, because if you get COVID, it's absolutely huge. If lots of in the thousands, as opposed to a small percentage of the vaccine. So that's one of the worst side effects of COVID infection, when you get really unwell, isn't it, Aruna?
Yeah, that's true.
Yeah. Okay. But yeah, as I said, that conversation with your clinician, whether that's GP or potentially a consultant, is the important start in getting the right advice for your particular situation. Would be absolutely what I would advise.
I've got a question, Barbara.
Yeah.
I was just wondering, the discussion around women who are unable to have the jab because of probably a bit older or high risk. I'm just wondering how soon after they've had the baby can they have a jab, and can they have it while they're breastfeeding as well?
Straight away, yes, and when they're breastfeeding as well. So why are they not able to have the vaccine through the pregnancy? What was the contraindication?
All right. Just looking back at the notes, if I've heard it correctly, I was just thinking about if they are in the later stages of their pregnancy and at higher risk, unless I've misread it.
I think.
Or they decide not to, maybe.
Yeah, because they want to protect. Yeah, they can have it during breastfeeding. Yes.
Yeah. Okay.
Yeah. And last time we did a session, Aruna, you sort of given that description of which part of the body, if you like, the vaccine works with, and that's very different to the part of the body that is responsible for milk production in terms of breastfeeding.
Yeah. So it really doesn't affect breastfeeding or pregnancy or fertility. So it really has no effect on it. In fact, it protects you. And again, it's so clear when you work on a labor ward, the protection that the vaccine has given. And yeah, I'm not so afraid anymore. I must say that.
Mm-hmm.
So even a couple of months ago, we were still having women. I think in my last presentation, I said we had somebody who had gone to have ECMO, and we still on a board, we were having that. But now we don't have it. We've just got we were coming through with COVID, but our wards are not so full anymore with COVID patients anymore. So you can just see the effect of vaccination.
Yeah. Okay. We've had a question that might be one for Viv. Do we think that the vaccines will need to be repeated annually?
Yeah, I think probably. I don't know, Aruna, I would say because of this mutations, I think it's very similar to flu vaccines. So flu vaccines, every year we have a vaccine because we slightly tweak them to match the circulating strains. I think we're going to see the same thing. The way this virus is behaving very badly at the moment, isn't it? where it just keeps like slightly shifting. It's and it's trying to escape the vaccines. That's what it's trying to do, and get around our immune system so it can keep replicating. So I think every year it'll be like virus will be running ahead, and then vaccines will be running ahead, so we can match them. So I would say it's probably going to be an annual vaccine.
Yeah. It's from one of our infectious disease consultants presentation. It's like a loop. We are in a loop with the with the infection, and so. But I feel in a way we've got to be grateful, because it definitely is. Compared to where we were last year, I feel definitely more hopeful.
Yeah, as do I. Much more optimistic. And I did read somewhere, Viv, that the mRNA vaccines could potentially be tweaked to cover a number of different coronaviruses.
Yeah. I think they take about 3 months to tweak them. So it's about being, doing all those things like hand washing and etc. And ventilation, all those kind of things while they're being tweaked. But yeah, they can be tweaked, which is good.
Yeah, absolutely. And I think you started to say it'd be a bit like the flu vaccine. So sort of the influenza vaccine that we have, or certain groups are offered on an annual basis, that was born out of flu pandemics that we experienced sort of through the 20th century. So that suggests that there may be a need for an annual, at least annual, once things start to settle down a bit. And
a lot of pandemics, they kind of last 2 to 3 years, and I'm really hoping this one follows that historical pattern and becomes then like a winter circulating virus rather than this constant up and down. And by this time next year, hopefully, if we have another meeting like this one, it'll have just become a normal cold and flu virus that's circulating. That's my hope. My fingers crossed.
I just hope you'll forget it and you'll ask me all about fertility and babies.
Okay. And I guess I absolutely share your view, Viv, and your hope, because it's been a really kind of hard 20 months for residents and for those in and around sort of health and social care settings. And I guess I have a hopeful optimism, please don't shoot me down, that because we now have so much more by way of modern technology, medical technology, that we'll be in a place perhaps sooner than might have been experienced through the 20th century. So Thank you. And then we've had a question, given the yellow card list, are we any closer to identifying who is likely to have side effects? Is that something that you want to start with, Viv?
That's a good question. I mean, I know the yellow card system has shown us all the side effects and certainly picked up the blood clotting. I don't know if it actually will see. It's a good question, because it'd be nice to know who's more likely to have the side effect. I don't think it's picked that up at all. I'm not even sure if it will do in the future, because it's such an individual thing, isn't it? I mean, I'm sure you all know people that have had no effects. My husband had absolutely zero effect, and I felt quite poorly. So I think it's a lot. So the yellow card system is really picking up the kind of common side effects in the population. But to actually be able to home down to individuals might be a bit harder. I don't know if Aruna would agree with that.
Yeah.
Yeah.
I think so. Yeah.
Okay. Having not reported anything through the yellow card system, do our residents or patients asked to provide any additional information beyond just I've had a side effect, such as their age or their ethnicity, that you're aware of?
Not that I'm aware of.
Okay.
I can have a look while we're online if you want. I can pull up a yellow card to see what's on it. So hold on a sec. I'll just mute myself while we're doing that.
Okay, that's great. Although the next question might be one for you to start off with, but sorry. If when the vaccine is tweaked, is it tested on a sample of people before offering it to the general population?
That's a good question. I don't know the answer to that. I don't know if Aruna does. I can look that up as well, though.
Okay.
Certainly with flu, because it's been going around, flu we've had for a long time, we just slightly change it. We slightly tweak it by putting a new virus strain in it. So I'm assuming they do something, we've got the technology, so they just tweak the vaccine. Unless they tweak it completely so it's different, then they'd have to test it. I think they're just changing the strain, but I can double check that.
Okay. So as part of our Q&A part after the meeting,
yeah,
we can make sure that we've got that information there. Okay. Is there any other questions or comments? And folk are very welcome to come on and ask it verbally if that's easier.
I've got a picture of the yellow card, actually. I can send you.
Okay.
Yeah.
I look forward to getting that. Thank you.
A nice card for Christmas.
All right.
What do we have from the yellow card?
Is that for Viv, that question? I think the question was what's on the yellow card.
Yeah, what's on the yellow card? Yeah, so I've got a picture of one, so I can send you the picture so we can see what sort of things they ask. But I think it is just general, age. Right. Yeah.
I guess there's always that balance between wanting people to report versus not having too much that's identifiable. So, okay, I think we will finish early. If there's any final questions, please do let us know. Otherwise, I will let those that have joined get on with their evenings, with great big thanks to both Aruna and Viv for coming along again. And thank you for joining, and hopefully this has been helpful to you this evening. Thank you very much.
Thanks, Barbara.
Okay. Bye.
Thank you.